Hi friends, welcome to Shiao's Weekly Note. My name is Shiao. I'm a licensed physical therapist in California. I've been practicing in an outpatient ortho clinic in Orange County for over 15 years. In this channel, we're going to share with you some cases we did in the clinic with different diagnoses. And this is aimed for just information sharing. It's not specific for your treatment. So if you have any issue, please go look for some medical assistance. Today, we're going to talk about the neck. This patient we have for today is a female in her early 50s, has been doing a desk job all her life, and her habitual neck pain is on the left side of the neck, and also on the upper trapezius area on the left side, sometimes accompanied with a headache. This is one of the typical patients we see in the clinic. In this video, we're going to briefly talk about the anatomy of the neck, and then the most common possible general cause of the neck issue, and then the solution, including exercise and stretchings that you can do at home by yourself. Okay, let's start now. All right, now let's take a look just briefly about the anatomy of the cervical spine. The neck, the cervical spine is composed of 7 vertebrae from C1, 2, 3, 4, 5, 6, 7. This 7 vertebrae is so-called the cervical spine. But please notice a very important fact that below the cervical spine is the thoracic spine. But look at the spine, they're connected together. So you can say the cervical spine is sit on top of the thoracic spine. Remember the principle we mentioned before? In order to treat the cervical spine, usually you have to treat the thoracic spine because it's the base of the neck. Also, there's some muscles from is connecting the cervical spine to the shoulder blade. The major one is so-called the levator scapula. It's from the base of the skull all the way to the tip of the shoulder blade. The other one is called upper trapezius. Is from the connective tissue here connecting to the spinous process and part of the cervical spine all the way to the spine of the shoulder blade, the scapula. So in order to have the cervical spine to sit in the proper position, not just the thoracic spine, the rib cage, but also the shoulder girdles you have to work on to loosen up the tension from the muscles so it's easier for the cervical spine to move. And one thing I want to bring up is here. There's 2 major arteries called vertebral arteries. It's passing through the bony structures of the cervical spine. You know that the artery is going up to supply the blood to the brain. Now the circulation inside the vertebral artery is highly related to the position of the cervical spine. Because of the design of the structure, it's more the middle and the lower cervical spine is moving more during the flexion and extension. But as to the rotation, like turning side to side, the upper cervical segments, it should be in charge of probably more than at least 40% of the movement. So it means the rotation should happen more on the upper segments of the cervical spine. And flexion extension should be more on the lower part of the spine. I would say is most of the people is having the neck issue is because of their posture. See, if you're doing a desk job after working for a while, your back feels tired, want to relax a little bit, but the stress from the work pushes you continue to work. So you have to pick up your head and look at the screen. And this is so-called the forward head posture. How to define is to draw a vertical line from the earlobe. That this line doesn't pass the middle area of the shoulder, then and the line falls in front of the shoulder. That means you have a forward head posture. Forward head posture, as you can see, your thoracic spine is flexing, and also your upper and middle cervical spine is extended. And see, in this posture, if you turn, the rotation is going to happen more on the midsection from C4 to C6. That's the most common spot that people are having issue on the joint. See, if you're holding this posture, you're adding a lot of pressure on the muscle here in this area called suboccipital area, and also the extensors. They're taking the pressure, and see, they're taking the pressure, is adding the pressure to the joint of the cervical spine. At the same time, if you're rotating, you're adding extra pressure to the facet joints, and over time it can cause enlargement of the joint, and little by little it's going to occupy the space of spinal nerve root. Okay, let's jump directly to the treatment part. All right, now it comes to the treatment part. The first thing is we don't go directly to the neck. We try to work on the breathing first. Okay, so try to make a fist and try to hold your fist by the side of your waist and try to tuck your elbow in, your kind of chest up a little bit, and squeeze your shoulder blades together, but keep the shoulder blade down all the time. Okay, in this position, you're creating an isometric type of contraction of your back muscle, kind of countering a little bit the forehead posture. It's actually not easy to hold it if your chest is very tight, and which happens to a lot of people with forehead posture. In this posture, you hold a little bit and start to do some deep breathing. Remember, push your tongue against the upper palate so it can help to recruit more the breathing muscle. And then when you breathe in, gently tilt up your head. You can open your mouth to exhale, release the air, and the breathe in. It's a work on the back muscle. It's very safe, so will not cause any injury for sure. But it's tiring. After a while, I would say 10 times or even more when you feel your warm up. Okay, now start to do our breathing exercise by putting the hands on the shoulder, and we go breathe in, look up. If you have pain looking up, don't go that far. It's okay. But remember, breathing is the key. If you can, go all the way up. Say after 10 times, you can do opposite. Say after 10 times, you can straighten your arm, do the whole arm, breathe in. If your neck starts to loosen up, go all the way up by looking at your hand. And go opposite, after 10 times opposite. Okay, then now you can do a very specific breathing by interlace your fingers, raise your hand from the belly button area and breathe in. Look at your hands, keep breathing in, and then release the air and interlace your fingers again. See, your neck is actually exercising a little bit by following the hand. And so you look up, back to looking straight forward. I do this every day in the morning as part of my Qigong practice. Okay, after that, now let's take a look at how to loosen up the shoulder. So in standing or in sitting, you can put your arm across and use the other hand to tuck the elbow in and try to avoid the shoulder elevation. If you go like that, you're not really stretching much. So try to keep the shoulder down, keep the good posture. See that in this position, try to take deep breath in. Whenever every breath, whenever you breathe in, you'll be able to feel more stretching of the whole thing. Okay, and then you switch after 10 breaths. Say after 10 breaths, the next one, if you can, put your hand on the back of the base of the neck and tuck your elbow. Hold the position, same thing, breathe in. And at the same time, you try to tilt to the other side. You can feel the stretching of the triceps and the whole shoulder girdle muscle on this side. And switch. Put the hand on the back of the base of the neck and then tilt. Remember, you're flexing. I should not say tilting. Tilting is like from the base, but this is flexing. This bending your back to the side. You should feel the stretching from the triceps all the way down to your waist. Okay, after that, you interlace your fingers on the back, straighten the elbow, squeeze your shoulder blade, and breathe in. This you can feel more stretching on the front of the chest muscle, also your biceps area. Also looking up at the same time. If you feel your neck is loosened up now a little bit, you can look up more. Okay. After 10 breaths, you can take a break. I think now we're ready to move on for the specific neck exercise. You can do this in sitting or standing. Okay. And later we're going to lay down. But now let's do this in sitting first. Same thing. Squeeze your shoulder blade. And then now look at me. I'm going to do a rotation of the neck. So when I rotate, I try to avoid my chin go to the shoulder. See, I'm not going to the side, but I'm trying to tuck my head in, trying to keep my chin as close to my throat as possible, like peeking to the back. Okay, it's more. If you do this correctly, you feel a lot of stretching. Try to imagine there's something on the chair. I'm trying to turn and look down. And when you turn, try to breathe in. So breathe in, look, and turn, and tilt back. So feel a lot of stretching of the upper trapezius muscle and also the SCM muscle at the same time. Breathe out. So breathe in and breathe out. After you warm up on your chest, after all those shoulder stretching warm up, now you're ready to do this. Remember, go with your tolerance. Don't over push it. Don't cause too much pain. After that, I think we're ready to do the exercise on our back. So on the table, you just kind of push your head into the table and then turn. So instead of when you turn, instead of rolling to the side, you try to push your head all the way down and then turn, keep your head in the same place. You're rotating. The benefits of doing this is to force your C1, C2, the upper segment area to move more in the rotation. It's trying to correct the bad habit of how you turn your neck in the forehead posture. So just keep pushing down, keep the pressure. See, when I turn to the side, I'm still keeping the pressure down. As you can see, the table is sinking in. I keep pushing, pushing, pushing. It's actually same movement as what we just did in sitting. See, after that, very important for the neck exercise is to, in this position, to put the chin to the chest. So we'll go up, try to breathe in. If this is too hard for you because of the weakness, use your hand to help the head to come up. And we'll go there, do a little bit stretching, and let it come back down. But notice I keep my chin tucked in all the time. Okay, keep your chin tucked in. Don't lose it. If you go lie down like this, you might hurt your neck. Okay, but keep your chin tucked in. It's very safe. I can say this. If you feel any pain, I can guarantee you it's more from the weakness and the stiffness. Just do it. Do it with according to your tolerance. And use your hand in the beginning to help until you can pick it up and drop it down by yourself with the chin tuck in all the time. Remember, this is very, very important. Chin tuck in. When you get even stronger, you can pick it up and turn. Let's see the same principle. When you turn, the neck stays in the same place. Okay, but don't do this yet until you master this movement. This is important. See how many you can do. Maybe you can do 10 times with no problem. Then do a little bit more, do it 20 times. But remember the principle, the chin has to be tucked in. And this is very safe. See, another thing you can do in this position is the crunches. Again, it's very safe. So look at me. You don't have to do a lot. It's not sit up, it's crunches. It's training your breathing. So try to take a deep breath in and breathe out. And breathe in. So see, when you do this, keep your chin tucked in. Maybe you wonder, is this have anything? Does this have anything to do with the neck issue? Yes, it's related to the core strength, and also by strengthening your breathing, it's going to get everything back to place with a proper core strength. Okay, you can do this 20 times, and you can put your foot on top of the knee. Use the elbow of the other side. Try to point the elbow to the knee. 20 times and switch. Okay? All right, I think that concludes our video. I have some final words here to share with you. Again, if the exercise or the stretchings cannot decrease your symptoms, I would say because you probably need some soft tissue work to loosen up those tight and stiff muscles first in order to make those treatments work. But I think in general, this information will help you at least understand the neck issue a little bit more. Okay, hope to see you soon. Bye.